Treating the midfoot actually first in this particular case, and he has history of soccer player, so lots of ankle sprains as a younger soccer player. All right, pull your knee into my elbow here. Yep. And my intention is to spread, especially that medial cuneiform off the middle cuneiform and relax. Let it go. Good. Coming into navicular, I want all of these midfoot bones to be able to come out of this inversionally held old ankle sprain position. I need to be able to get them to come into neutral, at least into neutral. I'm going to come a little bit lower, starting to come into the first metatarsal off the navicular, and I gather that first ray. Here's this lock up, pivot, land, pull into my elbow, and let it go. So that muscle contraction just helps with localization. It helps with freeing up of the joint. Pull in and let it go. Fantastic, good. And I'm also hooking the bottom of this first met because we want length, we want mobility and length of the first ray. So first met off the navicular needs to, we're compressed here, so we need to decompress, open up, get this joint to be able to come more medial, and then also have length throughout that metatarsal so that that first ray can get to the ground without compensating above. Pull in with your knee and let go. Very good. Okay, pull in one more time and let go. Fantastic. All right, keep filming. Go ahead and straighten that leg again for me. I'm gonna sit right over here. So we're gonna retest after each technique. Bring you there. So now I can start to get him into more dorsiflexion without, we're able to get more neutral of that midfoot. So now I can start to get a truer picture for what that dorsiflexion looks like. So then I check in what's my next barrier. I do have a calcaneus restriction through here that we need to get. Actually first, so I'm just going to hold here distracted. He's not gonna like me very much as I do that. Okay, so I'm distracting, bringing that calcaneus into inversion because it is, sorry, into eversion because it's held in inversion. It cannot access neutral, let alone eversion. I'm gonna distract, bring most of his foot into a more neutral position. There's my finger along the calcaneus talus line. Gently push into my chest with your foot on the gas pedal. And I am tractioning out with my bottom hand, scooping, and let go. Fantastic, good. So his restrictions aren't so much a talus restriction yet. It's more so midfoot and calcaneus initially. All right, relax that foot. I'm gonna bring you up into, nice. So that opened up just enough. So we've got quite a bit more, actually significantly more dorsiflexion than we had before. Now this one over here is going to be more of a distal talus, distal tibia into a talus. And maybe you sprained this ankle, but not nearly as much as that left one, right? Correct?
Mm-hmm. Yeah.
So I'm still holding him neutral, but the barrier is more of this navicular coming into the talus. So we need space of the, there, I gotcha. I need to scoop that navicular out of the way of the, actually I might be on talus, no, I'm on navicular. So I need to, we're gonna distract, scoop, and my vector is this to clear it. Gently push on the gas pedal. There is some midfoot restriction I need to clear up, but this is where I was gonna go first on this one. And let go, beautiful, good. Here's where distal tibia is gonna come in. And again, it's held in this, it's held rotated in this external rotation. This tibia is. And there's compression of the tibia against that talus. So I want to come in and get the tibia off the talus. Okay, gently push out or in, yep. And let go, you okay? Good. I need space through here, so I'm going to distract, really distract before I bring him into dorsiflexion, because that's my goal, is to improve clean, adequate dorsiflexion. gently push on the gas pedal and let go. So I'm scooping, tractioning with my right hand, and I'm mobilizing more so as I take them into more dorsiflexion, mobilizing with my left hand on the bone and joint itself. Okay, now I'm coming into lateral, a little bit lateral talus. Okay, push out. Yes, and let go. Perfect, good, 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 good. All right, stay right there. And let's bring you up and bring you up. So there, that quickly just created just more ease as we were able to realign and get the bones and the joints into a more neutral position. As we come into a more neutral position, we're able to get cleaner dorsiflexion. Thank you.